Good evening, Global Pulse family. I'm Samantha Newsby with your health update from the island of Jamaica. For years, Jamaica's health authorities have focused on improving primary health care, the first point of contact for most patients. These community health centers are vital, especially in rural parishes like Westmoreland, Hanover, Trelawney, and St. James, where hospitals can be miles away. But many of these centers have suffered from wear, outdated equipment, and limited space. Now, through Operation Refresh, the government is upgrading and maintaining these facilities to meet modern standards, from structural repairs to better waiting areas and medical rooms. Operation Refresh is not a one-time effort. It's a rolling program. As one center is completed, another begins. Repairs include painting, roofing, electrical rewiring, plumbing upgrades, and new furniture and signage, all to create a more comfortable and efficient environment for patients and staff.
Health and Wellness Minister Dr. Christopher Tufton says the initiative ensures long-term maintenance. As we finish one, we add another, and we'll keep going until every health center gets the attention it deserves.
Here's a look at some of the centers already being refreshed: Westmoreland, Grange Hill, Betheltown, White House, Savannah Lamar, Petersfield, Williamsfield, and Georges Plain; Hanover, Wakefield and Cave Valley; Trelawney, Falmouth, Duncans, Low River, and Bounty Hall; St. James, Mount Carey, Johns Hall, and Glendavon. Several centers are already showing results. Jacksontown Health Center in Trelawney is fully completed. Troy Health Center is about 40% done. Glendavon in St. James is nearly halfway through. Strengthening primary care is more than just construction. It's a shift in how Jamaica delivers health. The goal is to reduce hospital crowding by managing chronic lifestyle diseases such as diabetes, hypertension, and heart conditions at the community level, before they turn into emergencies. Dr. Tufton explains that this move will free up hospitals to focus on surgeries and critical care, while local clinics handle prevention and early treatment. Still, challenges remain. Renovations take time and money, and maintaining the facilities after they're upgraded is crucial. The ministry is also working to ensure staffing, training, and equipment keep pace with the new look of these centers. Over the next few years, Operation Refresh aims to expand island-wide, giving every Jamaican access to reliable, high-quality primary care in their own parish. From Savannah Lamar to Montego Bay, Operation Refresh is breathing new life into Jamaica's health system, one clinic at a time. I'm Samantha Newsby, bringing you the stories that keep the Global Pulse beating. Stay informed, stay inspired, and keep watching Global Pulse News TV.